Hello, class. Welcome to Flourish Nursing Academy. I am Tutor Godwin. Today we will look at hepatitis definition. Hepatitis: inflammation of the liver caused by infectious, viral, or non-infectious toxic autoimmune processes. It can be acute or chronic and may lead to fibrosis, cirrhosis, liver failure, or hepatocellular carcinoma. Common causes: viral, hepatitis, a virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, requires HBV, hepatitis E virus, HAV, HEV, fecal oral, usually acute only. HBV, blood-body fluids, sexual contact, perinatal, needles, can be acute or chronic. HCV, blood-borne, IV drug use, transfusions, often becomes chronic. Alcoholic hepatitis, prolonged heavy alcohol use, drug toxin-induced, acetaminophen overdose, acute fulminant, certain antibiotics, anti-tubercular drugs, statins, herbal supplements. Autoimmune hepatitis. Key epidemiologic clinical points: HAV incubation, 15-50 days. HBV, 45-160 days. HCV, 14-180 days. HDV only with HBV co-infection or superinfection. Vaccines, HAV and HBV available. No vaccine for HCV or HEV. Newborns of HBV plus mothers should receive HBIG plus hepatitis B vaccine at birth. Pathophysiology, viral or toxic agents cause hepatocyte injuries. Immune response, cytotoxic T cells, mediates hepatocyte death, inflammation, necrosis. Hepatocellular dysfunction leads to impaired bilirubin conjugation and excretion, jaundice, dark urine, pale stools. Disturbed bile flow, cholestasis, pruritus, elevated alkaline phosphatase, reduced synthetic function, decreased albumin, clotting factor synthesis, edema, coagulopathy, prolonged PT-INR. Impaired detoxification, hyperammonemia, hepatic encephalopathy, chronic inflammation, fibrosis, cirrhosis, portal hypertension, risk of hepatocellular carcinoma. Clinical manifestations: prodromal, preecteric, malaise, fatigue, anorexia, NV, low-grade fever, myalgias, RUQ or epigastric pain, headache. Icteric phase: jaundice, dark urine, clay-colored stools, pruritus, hepatomegaly, and possible splenomegaly. Severe complicated coagulopathy, bleeding, ascites, peripheral edema, hypoalbuminemia, hepatic encephalopathy, confusion, asterixis, sleep-wake changes, signs of portal hypertension, varices. Acute versus chronic: chronic often insidious with fatigue, anorexia, mild RUQ discomfort, may be asymptomatic until late complications. Diagnostic findings: labs and tests, LFTs, AST and ALT elevated, ALT often AST in viral hepatitis, AST, ALT in alcoholic hepatopathy, usually 300, bilirubin, total and direct are elevated, alkaline phosphatase, elevated with cholestatic pattern, albumin, decreased in chronic or severe disease, coagulation, prolonged PT-INR in synthetic. Dysfunction: ammonia, elevated with encephalopathy, supportive, not diagnostic. Serologies and molecular tests: HAV-IgM, acute, HAV-IgG, immune, HBsAg, active infection, anti-HBs, immunity, anti-HBc-IgM, acute, anti-HBc-IgG, past, HBeAg, high infectivity, HBV DNA, viral load, HCV antibody, screen, HCV RNA, confirm active infection, viral load, HDV antibody, HEV IgM IgG where appropriate, imaging, ultrasound for hepatomegaly, cirrhosis, ascites, CT MRI if needed. Nursing priorities: prevent transmission, protect others, monitor and support hepatic function and hemodynamic stability, prevent and detect complications, bleeding, encephalopathy, fluid imbalance, provide symptom relief and adequate nutrition, patient-family education, transmission, vaccines, medication safety, alcohol avoidance, nursing assessment, vital signs, jugular vein distension, mucous membranes, skin color, jaundice, pruritus, scleral icterus. Abdominal assessment. Hepatomegaly, tenderness, ascites, abdominal girth, bowel sounds, neuro, mental status, orientation, asterixis, reflexes for encephalopathy, bleeding signs, petechiae, ecchymosis, bleeding gums, melena, intake, output, daily weights, fluid balance, medication history, acetaminophen, herbal supplements, recent antibiotics, risk exposures, travel, sexual contacts, IV drug use, blood transfusions, occupational exposures, nursing interventions and rationale, infection control, standard precautions for HBV, HCV, bloodborne, strict hand hygiene, for HAV, HEV, fecal-oral, emphasize hand washing, contact precautions with stool contamination risk, safe handling, disposal of sharps, do not recap needles. Isolation, use as indicated by facility policy, educate on safe sexual practices and needle use. Monitor labs, LFTs, bilirubin, albumin, PT-INR, platelets, ammonia, report worsening trends. Manage bleeding risk, monitor for bleeding, minimize invasive procedures. Apply pressure to bleeding sites. Administer vitamin K for prolonged PT if ordered. Transfuse platelets or plasma per protocol. Fluid and electrolyte management. Restrict fluid, sodium for ascites if ordered. Diuretic therapy monitoring. Paracentesis care and monitoring if performed. Nutrition. Small, frequent meals, adequate calories and protein unless encephalopathy is present. In encephalopathy, protein may be restricted temporarily, but severe protein restriction is no longer routinely recommended. Avoid alcohol and hepatotoxic drugs, especially acetaminophen. Consult a dietitian for a high-calorie, high-carbohydrate diet and vitamin supplementation. B vitamins, fat-soluble vitamins, if cholestatic. Rest and activity. Encourage rest during the acute phase. Gradually increase activity as tolerated. Symptom management. Antiemetics for NV. Skin care and antipruritic for pruritus. Cholestyramine may be used. Encephalopathy management. Recognize early signs. Low-protein diet initially if severe. Lactulose to reduce ammonia. Monitor stools. Rifaximin per order. Maintain airway if advanced. Medication administration related to specific hepatitis. Antivirals. HBV, tenofovir, entecavir, interferon sometimes. HCV, direct-acting antivirals such as sofosbuvir-based regimens. Monitor for adverse effects, adherence. Avoid hepatotoxic medications. Review all meds and supplements. Perinatal care. If mother HBV+, ensure newborn receives HBV vaccine plus HBIG within 12 hours of birth. Education and follow-up. Importance of vaccination, HAV and HBV, post-exposure prophylaxis, abstain from alcohol, avoid sharing razors, needles, and safe sex. Importance of completing antiviral regimens and follow-up labs, LFTs, viral loads, and screening for HIV when appropriate. When to seek emergency care, worsening jaundice, bleeding, confusion, severe abdominal pain, high fevers. Common nursing diagnoses, risk for infection, transmission, imbalanced nutrition, less than body requirements, risk for bleeding, activity intolerance, risk for ineffective hepatic perfusion.